All right, let's jump right in. Today, we're diving into a really crucial, but honestly, often hidden part of spinal cord injuries. We're going to look beyond mobility, beyond what you can see on the outside, and explore the internal battles with bladder and bowel control, and the incredible ways patients can reclaim their lives.
When most of us hear spinal cord injury, our minds immediately go to paralysis, to not being able to walk. But that's not even half the story. The damage actually goes much, much deeper, and it messes with some of the body's most basic automatic functions.
So, here's what we're going to cover. First, we'll look at that unseen side of these injuries. Then, we'll get into what happens when the bladder malfunctions and how people can actually reclaim control. After that, we'll tackle the huge challenges of the neurogenic bowel and the personalized programs that can make all the difference. And we'll wrap up by talking about the absolute vital role of the nursing team in all of this. Let's get into it. And look, this isn't just a matter of comfort or quality of life, though that is, of course, hugely important. The internal effects of a spinal cord injury, especially with the bladder and bowel, are directly linked to a higher risk of mortality. Yeah, it's that serious. Think of it this way. A spinal cord injury is like cutting the communication lines between the brain and some of your most important organs. When that nervous system control is lost, the bladder and bowel just can't function on their own anymore. And that can set off a whole chain reaction of severe and sometimes even life-threatening problems. And if you want to understand just how severe this is, get this. The leading cause of death for patients with spinal cord injuries isn't the injury itself. It's chronic kidney disease. And more often than not, it's a direct result of the bladder not being managed properly, which leads to irreversible kidney damage over time. So this specific kind of dysfunction has a name. It's called neurogenic bladder. And it's really important to get this. It's not a disease of the bladder itself. The bladder is fine. The problem is that broken communication line between the brain, the spinal cord, and the urinary system. The messages just aren't getting through. So what actually happens to the bladder? Well, after an initial spinal shock phase where the bladder is just totally inactive, one of two things usually happens. It can become hyperactive or spastic, meaning it just contracts whenever it wants, without warning, or it can stay inactive, what's called flaccid, where it can't squeeze to empty itself at all. Either way, both of these outcomes are incredibly difficult to manage and they come with serious risks. In those risks, they are huge. It doesn't matter if the bladder is overactive or underactive. If it isn't emptying properly, you're looking at constant infections, painful kidney stones, and something called vesicoureteral reflux. That's basically when urine gets forced the wrong way, back up into the kidneys, and over time, all that damage leads directly to that number one killer we mentioned, renal failure. Okay, so that's the scary part. Faced with all of these challenges, what can actually be done? Well, the goals of any treatment plan are pretty clear. You have to protect the kidneys at all costs, you want to achieve continence, and ultimately, you want to give the patient a better quality of life. The number one way to do this, the gold standard of treatment, is something called clean intermittent catheterization, or CIC for short. So instead of having a catheter in all the time, the patient or a caregiver inserts a temporary one several times a day, just long enough to make sure the bladder is completely and safely emptied. And the benefits of this? They're absolutely transformative. CIC dramatically cuts down on long-term complications. Patients have fewer symptoms. They can actually sleep through the night without interruption, and they get the freedom to be physically active again. The impact on their overall quality of life is just profound. But, and this is a big but, it's not a perfect solution for everyone. To do CIC, you need a certain amount of manual dexterity, which some patients with higher level injuries just don't have. It also requires a really strict schedule, and you have to be on top of it, which means if the patient can't do it themselves, they absolutely need a strong support system. Now, almost everything we've just talked about with the bladder, well, it has a parallel when it comes to the bowel. The condition is called neurogenic bowel, and it happens for the exact same reason. That connection to the brain is just gone. And what that leads to is chronic constipation, a total loss of control, and honestly, a deep, profound anxiety every single day. This quote, wow, it just really gets to the heart of the psychological weight of this condition. I mean, can you imagine being constantly worried about having an accident? That fear can be so incredibly isolating and makes it really hard for people to feel confident enough to go back to work or to social events, or really just to be out in public. So the solution here isn't some simple pill or a single procedure. It's a highly personalized and consistent program, a routine that's tailor-made for an individual's body and their lifestyle. And for it to work, it really has to have multiple parts working together. And you can think of it like 4 main pillars. It all starts with diet. Getting fiber and fluid intake right is the foundation. Then you have medications to help manage the timing and consistency. The third pillar involves physical techniques like suppositories or manual emptying, all done on a very strict schedule. And finally, for some, colostomy surgery can be a truly life-changing option that gives back predictability and independence. Okay, so we've talked about techniques and programs, but none of this works without a critical missing piece, the human element. This is where the skill, the dedication, and the education of the nursing team becomes absolutely 100% essential. This quote really says it all. It's the nurses who teach these incredibly personal and complex routines. They're the ones who educate the patient and their family. They troubleshoot all the little problems that pop up, and they provide that consistency that makes a program stick. They are the bridge between a medical plan on a piece of paper and a patient's actual daily life. So that really leaves us with this final thought. When you're managing conditions that are this intimate, this integral to a person's sense of self, what's the role of that skilled, empathetic nurse? It goes so far beyond just medicine, right? They're not just caregivers, they're teachers, they're coaches, and they're partners in helping someone restore not just their body's function, but their dignity.